Okay, good afternoon, ladies and gentlemen. I'm told that we are now live, so we will make a start. I'll talk a little bit on item 2 about myself and introduce myself then, and we can have some introductions around the table then. First of all, Liam, can I have the apologies, please?
Thank you, Chair. I've received apologies from Peter Axon, Rachel Galliot, Phil Pusey, Elliot Sherrard-Williams and Michelle Hickmott.
Okay, thank you very much. So any members of the board, any declarations of any interest at all? Okay, I'll take that as a no. If we can do the minutes of the previous...
I think Tracy's come in lieu of Peter Axon. Tracy Shewan.
Hi, I'm Tracy Shewan. I'm deputising for Peter Axon.
No problem. So I'll go round the room just in a moment. So the minutes of the previous meeting then are, which was held on the 9th of June there, for everybody to read. Firstly, for any accuracy, if anyone's got anything they want to raise accuracy-wise. No, in which case then we'll take that as a true and accurate record. We don't have any members of the public present, so I make the presumption that there are no questions from the public. So we go to item 2 then, welcome from myself and the Vice Chair. So I'm Mark Sutton. I'm the Cabinet Member for Children and Young People at Staffordshire and have been a member of this board almost since it first started. Initially in a role with adults, and then for the last 6 years as Cabinet Member for Children and young people. So I'm chairing it. My colleague Julia Jessel is going to be the Vice Chair of the panel, so of the board. So what I'll do is go round the room to my right. People can introduce themselves, so we've got a record and everybody knows who everybody else is.
Thank you very much, Chairman. I'm Julia Jessel. I'm Cabinet Member for Health and Care. Prior to that, I had Environment, Infrastructure and Climate Change. I've been on the county, I'm just rapidly thinking, I think it's 6 years. But I have actually been a local elected member for nearly 40 years. So, and I've worked in the NHS apart from private industry. So one might say I've been around rather a long time. Thank you.
Thank you, Chair. I'm Liam Archer, Member in Democratic Services Support Officer for Staffordshire County Council.
I'm Ian Reid from Staffordshire Fire and Rescue Service. I'm the newly appointed Head of Prevent, Protect and Partnerships within the service, representing Michelle Hickmott today. Ian, yeah.
Richard Harling, Director of Health and Care for the County Council.
Good afternoon. I'm Tim Clegg. I'm Chief Executive of Stafford Borough Council and Cannock Chase District Council, here representing the District and Borough Chief Executives.
I'm Jill Heeson. I'm the Cabinet Member for Community Safety and Wellbeing with Newcastle Council.
Gary Jones, Chief Executive, Support Staffordshire.
Hello, Baz Tamise from Health Watch. I'm the manager there for Staffordshire.
Tracy Shewan, Director of Communications and Corporate Services for the NHS Integrated Care Board, deputising for Peter Axon today.
Rita Heseltine, Cabinet Member for Regulatory Services and Deputy Leader at South Staffordshire Council.
Natasha Moody, Assistant Director for Wellbeing and Partnerships, not a member of the group but presenting today.
Neelam Partwaj, Director of Children and Families for Staffordshire County Council.
John Topham, working in Health and Care, and I support Mark and Julia on the board.
So before we move on to item 3, this will be the first health and wellbeing board we've had since we don't have CCGs, and it's the ICS system and the ICB. So there is some work, I think, to be done, and I met with Peter Axon last week or the week before to start to discuss some of this, how the two systems work together. From my perspective, from a view of having as little duplication as is possible, and having a distinct role for this board going forward. So as we move through today, perhaps when it comes towards the end and any other business, if people can have a little think about that after we've been through the agenda, welcome to take some comments on that. It will be a substantive item on the agenda of the next meeting in December. So we will try and work up some sort of proposals of how that will work. But obviously for that, we would like input from yourselves so that we can develop those. So we will do that going forward, and I'll be working with John and Julia and others to start to develop that as we go forward, because we need. While there is statutory needs to be a health and wellbeing board legally, we need to have a distinct place, as far as I'm aware, in the system, so that the work that we do or oversee or ensure is being done is not just duplication of what someone else somewhere else in the system is doing. Because I certainly speak for myself, and I probably know I speak for Julia in relation to we both believe that we can have as little duplication as is physically possible. You know, the aim of the day is to get things done. Anybody, any initial comments on that at all? Okay, in that case then we'll move on to item 3, which is healthy start, and we have Neelam as the member of the board promoting that, and Natasha Moody here to do that presentation. So Natasha, can I leave that with you?
Thanks, Mark. So good afternoon, everybody. I'm just going to talk you through an update really in terms of children's health. And we've been asked to do this as to give the board an overview really of how we're contributing towards the overarching health and wellbeing strategy. So I'm just going to talk you through, if I can, a couple of slides that will hopefully give you a bit of an overview of the work that we're doing. And then also included in the pack, we've included a paper around governance, which I'll pick up on after, if that's okay. So, as you'll all be aware, the Health and Wellbeing Board strategy has got a number of priorities relating to children and young people. The one that we're going to talk to you about today is health and early life, but obviously we do obviously try and make sure that children have good mental health and healthy weights as well, which I know are part of that strategy. And I'm just going to talk you through some of the initiatives or work that we've been doing as a partnership that contributes towards some of this work. So the Families Service currently provide health visiting and school nursing services that are provided to families in Staffordshire. That service has been in place for a number of years now. We're coming towards the final year of that contracted service. And actually we're continuing to provide support across Staffordshire children and young people. And actually what we've seen is massive improvements really in terms of that service, in terms of the way in which it's delivered, not only in terms of the uptake of those visits, but also a much better relationship, I think, formed between ourselves and MPFT in terms of making sure that works. They've got a number of different priorities and mandated checks that they have to complete. And some of those priorities we're going to pick up and talk to you a bit about today. So infant mortality is definitely one of them. So in terms of infant mortality, this is a priority that's picked up across multiple partnerships. So if anybody's seen any data, I suppose, relating to children and young people, you'll know that the infant mortality rate in Staffordshire is particularly poor. We're an outlier compared to other local areas, and for that reason a lot of people are interested in what we're doing about this. So I'm pleased to inform you that we've recently taken a paper to the Maternity Transformation Board, which is part of the integrated care system, and we've got agreement for a whole system approach to infant mortality across Staffordshire and Stoke-on-Trent. And I think that's really important actually, because a lot of the factors that contribute towards infant mortality are wider determinants of health, and not necessarily, most of the families, for example, will probably be known to the services and support that we provide elsewhere in that system. So actually we've got agreement that across Staffordshire and Stoke-on-Trent we'll work collaboratively on our approach to infant mortality. We also commission a Stop Smoking in Pregnancy service. Again, the uptake of that service has increased in recent years, and we've extended that to include smoking fathers, as this has caused a barrier for mums giving up smoking because they were saying actually the partner was still smoking. So that's something that we've done, kind of tweaked really over the last 12 months to try and make that better. We've also got in place a whole system approach to infant feeding. You'll see a bit of a trend here in terms of whole system working. We've been working in this way probably for the last 6 to 12 months in terms of infant feeding, working across again Staffordshire and Stoke-on-Trent so that we've got a shared plan of attack really in terms of trying to increase those breastfeeding rates, as we know that has a big impact in terms of infant mortality. And we've also been working with the Child Death Overview Panel in terms of the implementation of an ICON campaign, which is again a national campaign which is about infant crying basically as being a normal thing that we should expect babies to do, for those of you that remember those times well, to prevent kind of abusive head trauma. So that's a big key piece of work that we've been doing really across the system. We've done a lot of work in terms of mental health, which I know wouldn't be a surprise probably to most of you. And again, this is something we've been working with the integrated care system on. So there is an existing children, young people's ICS group, which has got mental health as a focus. That work is led by Josie Povey from North Staff's Combined Healthcare, and we're part of that group. So we work very closely with Josie to try and make sure that children and young people experience good mental health. We know this has been a particular challenge for young people, particularly as we come out of the COVID pandemic. We've probably tried to give that board a bit more structure and tackle some of the underlying issues that people kept talking about. So it might feel like there's lots of groups there meeting to discuss stuff, but actually they're really task groups to try and get some of those issues resolved, because I think anybody who knows anything about children and young people's mental health would say that actually there are lots of things that we still need to do there. So Karen in our team is currently leading the work around care experienced children and young people's working group. But again, that kind of governance structure, I would say, has gained a lot of traction, particularly over the last 6 months, where we've started to see some really positive working. And it might be kind of useful for the board to know that actually we've been held up as an example of good practice regionally with the West Midlands for the work we're doing in terms of mental health. So I know there's still lots to do, but actually the West Midlands are saying the partnership approach that we're taking to children's mental health has been incredibly well received. So that should hopefully give you some assurance that the work we're doing is going in the right direction. Some of the work that the partnerships have done as a result of that working better together is we've got a Kind Minds newsletter. That was something that schools kind of suggested we did, and we've been sending that out for over 12 months now. Feedback on that has been really positive. Again, it's a real partnership approach to that newsletter. So there are articles that go in there from North Staff's Combined, MPFT, ourselves, voluntary sector organisations, district and boroughs, schools themselves. So it's been a real kind of collaborative effort really in terms of getting the key messages out there and sharing really some of that good practice that is happening across the system to try and engender more of that to happen. We've got a senior mental health leads and education network meeting. People who work in schools will be pleased to hear that these run in the morning before school and also after school, and have really started to bring together mental health leads across the education system so that they can be better able to support children and young people with their emotional needs in school. And I have to say that's been really positive in starting to help the schools to understand what more action they can be taking without just an onward referral, because quite often that isn't necessarily the answer for the child, young person who's experiencing that poor mental health. And so that's something we're incredibly proud of, and we've just done a kind of survey with the schools to understand what the kind of impact of that has been for them, and the impact of that has been really positive from a school's perspective. We were also part of an Anna Freud School College Links programme. So this is a national programme that ran from January to March, and we've worked very closely with the Anna Freud School in terms of trying to develop that programme. And again, that's linked with all of the other work we do, so we kind of promote that via Kind Minds and through the Senior Mental Health Leads workshops. And we've run in collaboration with the CCG and now the ICS, the I Thrive workshops, which is again that principal way of working in terms of trying to get that earlier help and intervention instead of, like I say, that onward referral. And finally, we've done some work with the Department for Education around Wellbeing for education return. So we've done a lot of training and support to schools to help them to ensure that children and young people are able to return from the COVID pandemic and into the school setting well, so that they don't experience some of that low-level anxiety, and that they're able to support them once they do come back, having kind of experienced a prolonged period of time away from school. So those are some of the key things that we've done over the last 12 months in relation to mental health. And then finally, the last one that we wanted to talk to you about that contributes towards strategy is the healthy weight. So we have seen an increase in number of children and young people with obesity or being overweight, and that's not something that we want to see. And so we do commission a family weight management service. Again, the onus is very much on the family being able to eat healthily, because quite often it will be children who live in households with an adult who is overweight or obese who will have that child who's therefore overweight and obese. So it's really taking that whole family approach to try and tackle those underlying problems really. And then we've been working with adults colleagues to deliver Better Health Staffordshire. So this is something that hopefully all of you will have heard about, because I know we've been presented on this a number of times, so I won't go through it in too much detail. But what I should probably tell you is that we are now in the process of extending the Better Health Staffordshire to a further 3 districts, so it will just leave a remaining 2 districts left to be done. But actually the work on that, I think, has been a really good example of trying to understand and establish what the root causes are to that. And I'll be the first person to leap towards a solution, because I do like to fix the problem, but actually it started to reveal to us some quite interesting themes that are emerging as a result of doing that work in a different way. So for example, I would have quite easily told you that actually the reason that some of the children are overweight is because they have a pudding every day at school, and what we saw during COVID was that actually increased time at home made them more overweight or obese. So actually it's been really interesting to kind of get underneath some of that work. And I suppose we do appreciate the board's kind of time really in letting us try and get underneath that better and understand the problem more, so that we can try and develop the right solutions for that. And so I shall take a break and take any questions on that before I move on to the governance paper, if that's okay.
So I'll make a start. It's not so much a question, just a comment. Clearly quite a lot of work going on there, and I think what is pleasing with a lot of it is how it involves partners, and it's a partnership approach, or as referred to, a whole system approach, and not a lot of individual organisations just trying to do the bit and stuff being missed. So open it out for any questions or comments at all.
We had a presentation at South Staffs at our Wellbeing Select Committee from Peter Axon, and also at our informal cabinets. And we said we've got so much information and data at South Staffs, but we don't feel as if we've actually been included in a lot. And we've got information that could be used, particularly with the obesity one. We've got information from our localities that would be useful, but we don't feel as if we've actually been asked to contribute. So I have been asked to flag that up, although we did at those 2 meetings as well.
So funnily enough, Karen and I were talking this week about the extension of Better Health Staffordshire. So South Staffs will be one of the areas, so hopefully when we do come out to the district it will enable that much better, I think, conversation around some of this work. We did go out to the districts and boroughs to ask for representatives on different parts of work, so more than happy to kind of circulate that, take that away as an action, to circulate that again to district and borough colleagues, so that they do have an opportunity to kind of influence some of that work, because actually it's really important that we do get that kind of voice really as part of those groups. I can also go away and check if there are other district and borough reps on, so that I can let you know who those are in case.
And of course, I think if I'm right, Natasha, wasn't it 1 or 2 things that we presented at South Staff's overview and scrutiny was around the healthy weight one in particular? So I do think there's some opportunities there, isn't there, to be able to utilise the data that districts and boroughs have got, which sort of brings me on to the a little bit about how, you know, as a health and wellbeing system across the whole of the county, we make sure that the people that attend this meeting are, you know, are able to be able to represent the whole of the county from a district and borough level, so that we don't miss any of that sort of information that's available out there. Julia?
Yes, thank you, Chairman. Mine is with regards to infant mortality. Whilst I appreciate the fact that they, although we're an outlier, they're still relatively small numbers. You know, it is something that we do need to make sure that we improve on. When I look at the key themes of the work that's been done, one of the issues that will impact on the health of the unborn and the newly born child is, of course, drug and alcohol abuse. And whilst I understand you have to be a little bit careful, not keep widening the agenda, that it's unmanageable, I just wonder what interaction there is between the drug and alcohol services and how perhaps they can support pregnant mothers and mothers with newborns in terms of addressing their and giving a real focus and support on helping them get off their drug and alcohol abuse, because it does have an impact on the health of that young child, but also there is scientific research that says it has an impact on that child's mental health.
So Julie, just to kind of elaborate a little bit more. So what we've included in here is kind of the key things that we know are going on across the system that are impacting most on infant mortality. And we use that based on the child death overview panel data. So we do see kind of, you know, real children who have unfortunately died and what were the circumstances that kind of made that up. The numbers that are highest are probably related to smoking and less so to do with drug and alcohol, although it will be a factor, I'm sure. We're really fortunate in Staffordshire because we work with adult services, and we have an IFS light service, so and an IFS service, which is basically an intensive prevention service really for mums and families who've got drug or substance misuse issues. So actually we're really lucky that they get an intensive level of support wrapped around them, working with adults colleagues and the adult service provider. So again, more than happy to kind of take that away and provide some information on that if that would be useful.
Thank you, Chair. And I just want to echo about the collaboration and the Integrated Care Board, even though still probably in its infancy, are looking at structuring themselves around portfolios, and one of them being children and young people. So what we're trying to do is make sure that we are aligned with the work that goes on across the whole of the system. So hopefully by our structuring ourselves around these portfolios, that will actually aid the working that we're taking forward.
Thank you, Chair. Also, you know, very positive to see the partnership working. Ourselves, we've been involved in the Better Health Staffordshire piece of work, which has been, you know, really positive. And as you say, looking at those real underlying root causes. Noting the particular focus on mental health, emotional health and well-being, I'm interested to understand whether you think there's a similar level of collaboration and partnership, or is there room for improvement, particularly around autism services and early years, early identification and support? And is that on the radar, do you think, of the group? Or?
So I think we have a really strong kind of Send and Inclusion Partnership Board. That Send and Inclusion Partnership Board have got a strategy and a delivery plan. Part of that delivery plan has definitely got a focus on children with autism and learning disabilities. There's been a lot of work that's been taken place by that Send and Inclusion Partnership relating to specific projects that have been asked for by the national team. Again, largely driven by NHS England around LD Key Worker Pilot, for example, autism in school. So there's been a lot more collaboration. When we had the recent law inspection, the inspectors were really complimentary about the way in which we'd co-produced the approach to autism in schools, and I'm not taking the credit for that. It was, you know, completely the work of the CCG and the parents, really, and kind of held that up as an example of good practice. So I would say we're still fairly early doors, but actually the work that we have been doing, I think, is taking a positive step in the right direction, and I'm confident that that will lead to further work that's kind of increasing or improving the experience of those with learning difficulties and autism.
Okay, if there's no further questions on that children's health element, Natasha, next part of your presentation, please.
Okay, so if you were here last time, unfortunately, you might have heard my dulcet tones before. So last time I came to speak to you, I talked to you about the partnership protocol. And for those of you that were here, we basically have identified that we would like to work better together as a partnership. And in doing that, we want to try and use Healthy Start as a test for that way of working. So, unfortunately, you were the first board that asked for a paper that was duplicating effort somewhere else in the system. And so we thought we would come and test that approach really with you. So basically, we said in that partnership protocol that we wanted to try and, as much as possible, make it clear about who was the responsible kind of lead really for that agenda. And we would try and work so that we reduced some of the burdens really being placed across that system of multiple reporting multiple times. This report's been pulled together for you all as kind of the lead organisation for this agenda, but actually it does interface with a lot of other boards that we're talking to. And so I wondered if we might be able to ask for the chair to meet with the other chairs of the partnership boards. We talked last time about the chairs meeting being set up, for, I suppose, a conversation about how we start to reduce some of the bureaucracy attached to the kind of multiple reporting multiple times. I suppose what I would say is I absolutely want to give the Health and Wellbeing Board the assurances it needs, but I wonder whether we could take a more planned approach to maybe working in partnership together, so that we maybe look at maybe an annual report coming from the Family Strategic Partnership Board. And again, it probably does lean back to that conversation you started with Councillor Sutton earlier on around the fact that actually that relationship with the ICS and the Health and Wellbeing Board is still fairly new and emergent, and actually it feels like a really good time to be having that conversation about how do we start to iron out some of the bureaucracies really underneath the kind of multiple reporting, so that we get that right from the start. So I suppose the ask of today is, are you in your capacity as chair and as a board happy to support us to try and test that approach really with this piece of work?
So as part of the paperwork, there's a partnership meeting structure. Last year, slightly out of date, so some of the chairs of those individual meetings have changed, but it does indicate the complexity of the structure and how many different boards and groups there are inter-reporting to each other. So I think Natasha makes a really strong point, and it alludes to what was said earlier, that lines of reporting are as simple and as straightforward as physically possible. Groups, particularly groups down doing all the working and actually doing what we're asking them to do, don't end up having to spend most of their time telling everybody else what they've been doing. So I think there is some work around that, and I think personally it would be useful for a group of us, including the chairs of those 4 boards, to come together, and I would also include Peter in that as well going forward. But happy, willing to take any thoughts and comments about that from anybody, either now or as we move forward.
Thank you very much, Chairman. I'm very supportive of that approach. When you look at this, you become quite horrified, because I think if you're not careful, as you quite rightly say, you're actually detracting from people getting on and doing the job and providing the service for the people out there who we want to do and support. And all this takes time, and time, it's taking people from often the work that they really want to get on with, and time is money. And I think one of the things that, as the chairman knows, I keep saying we need to cut back on bureaucracy, because actually it just ties us all up in knots. So I'm very supportive of that approach. And I think the one question with all this, to ensure that we've got good governance and we're only doing what we need to do, is ask the question, why? Why have we got this board that reports into here and to here? It's a question that a child will ask you to the point of distraction, but it's a very simple question, and if you can't answer it, then actually you have to say, why are you doing it? So get yourself armed with about 100 different why are we doing this, because often structures develop over time and get added to and get more and more confusing. And I think, as you say, it's a really opportune time to actually say, if we don't know why we're doing it and it isn't a statutory function, then why are we doing it? So I very much support that approach.
Yeah, I can confirm that obviously we will be honoured to be involved with all this, and it's Peter and probably Heather Johnson, who is the Senior Responsible Officer for the maternity programme, who's probably where they need to link in, and she probably sits on some of these boards as well, so I think there'll be actually some way if we can reduce some of the bureaucracy actually at the meetings as well.
Any other comments? Okay, in that case, I mean, governance is important, but if you don't get the doing right, there's nothing to govern, is there? At the end of the day. Okay, Natasha, is that it? Okay, thank you very much for your attendance. I think we're probably just a little bit ahead of schedule, aren't we? Do we need to wait for Roseanne to present that, or are we able to do? Richard? Or because the next item's Tilly as well, so it's not like we can jump an item.
Yeah, I'm happy to take the Better Care Fund item, Chair, if that's okay. This is a bit of an update on the Better Care Fund. It just brings us up to speed with the development of the national policy framework and sets out the requirements for us to submit a plan. Roseanne's arrived. There is a table on funding, which I think it's important for us to note, and there is a recommendation that the approval of the final plan be delegated to the chairs. That's just so that we have opportunities to submit it, given the timescale. So, Roseanne, you missed the start of that. Just gave a quick précis. Is there anything you particularly want to draw attention to?
Apologies, I think you've mainly covered it, but yeah, in brief, we have a requirement to submit an Excel template, a Word document, and a new requirement to develop some capacity planning. I just wanted to bring attention to the board that there'll also be a new requirement this year. They'll bring back, the requirement for us to report. So they paused that during COVID, and they've given us some time, but this year they're bringing that back. But I'm not sure if you've already mentioned this, Richard, but it's largely similar to last year as expected. And because we're so far in the year, in Staffordshire, we've already extended all our existing schemes. We've just adjusted the figures for inflation, and we've extended them all. So I would like to request for the board's approval to delegate approval to the chairs, which means that when we've completed the plans, they're currently being completed at the moment in partnership with the ICB. When they're completed, if you agree to delegate approval to the chairs, I can then put some briefings in with you to go through them and check that you're happy with them before we submit them.
Okay, Roseanne, thank you for that. My apologies for starting before you got here. So
yeah, apologies if I've missed what you've said, Richard, or duplicated anything you've said. But if you want me to go over anything in the report, that's absolutely fine.
Well, I'm going to ask members of the panel if there's any questions on that. So, on that point, are there any questions of either Roseanne or Richard at all? Okay. Stony silence. So the recommendations A to D are there, and in particular the delegated approval to the Health and Wellbeing Board Chair is there. So is everybody in favour of those recommendations? Yep. Okay, lovely. Thank you very much. Roseanne, thank you very much for your time.
Okay, thank you. That was very brief, but I shall put some briefings in with the chairs to go through the plan in the next couple of weeks before it's submitted. Thank you.
Lovely, thank you very much.
Thanks.
So brings us now nicely on to item 5, proposal for delivery healthy ageing workshops. Have we got Tilly yet or not? Okay. Yeah, that's not a problem. We are a little bit ahead of time. If anybody wants to go and get a quick coffee or drink of water, that's absolutely no problem at all, or use any facilities that they need to. Okay, thank you. Welcome back, everybody. So item 5, proposal for delivering healthy ageing workshops. We've got Tilly Flanagan with us. Welcome, Tilly. Do you know everybody around the room, or do you want some introductions at all? Okay, if we can go quickly around the room, those that perhaps don't know Tilly, and we start from Rita. I think that's probably the best place. We've met.
Tracy Sheeran, Director of Communications for the Integrated Care Board.
Baz Tamiz, Manager for Health Watch Staffordshire.
Jill Heason, Newcastle Borough Council.
Ian Reid, Staffordshire Fire and Rescue Service.
Okay, I think that.
And Neelam Bharadwaj, I'm Director of Children and Families.
Okay, thank you.
Over to you then.
Okay, thank you for letting me attend today. What I've shared with you is a paper that outlines a proposal for the board to deliver some healthy ageing workshops. It could be 1 or it could be 2 workshops. And really this is about how we may be able to inform the development of a healthy ageing plan for Staffordshire. I suppose the rationale for bringing this to the board and asking the board to sponsor these workshops is really about building on a discussion that took place back in March of this year with this board. And at that meeting, the ICS came, some representatives from the ICS came to share the healthy ageing and frailty strategy. So that's obviously a strategy that covers across Staffordshire and Stoke. So they shared the whole of the strategy, but there was quite an emphasis on the healthy ageing work stream. And we talked at that meeting about how the priorities that sit in that strategy via the ICS are very, very similar and align very neatly with the priorities of this board. So at that time it was a draft plan, the Health and Wellbeing Board, but it's now sort of been agreed as a plan, and one of those 4 priorities is healthy ageing. So it was, I think this board recognised there was some clear alignment, and at that meeting we did say, can we actually have 1 plan rather than multiple plans to basically sort of work on this agenda, which you as a board did agree. What we have now is since then we have had some progress in terms of some of the work around healthy ageing. We've been able to deliver some of the activity that we had set out. We have making every contact count training that's being delivered across Staffordshire and in parts of Stoke. And we are also in sort of very closely to developing a loneliness and isolation strategy. There's another piece of work that's been commissioned through that group, which is looking at some research that Staffs University are undertaking, which is really looking at the impact that COVID may have had, particularly around physical activity and older people, if it's had an impact. So we are awaiting the results of that. However, I think there's a recognition in terms of the work of that group. There's much more that needs to be done. If we really, really want to make some progress in terms of ensuring that our older population do remain healthy for longer, because we know that will really have an impact on all sort of public sector. The longer we can keep people physically active, mentally active, engaged and involved within communities, it will keep them sort of stopping to sort of tip into sort of that frailty agenda. So there's a recognition that we do want to do more, and we have had an offer from ICS funded partnerships to basically bring an external person in who has a really good track record on developing plans with other local areas to really sort of look at what partners can do collectively and collaboratively on this agenda. So say we've had an offer from the ICS to say if this is something that the board would like to take on board, that they are willing to sort of support. So say the purpose of really coming to the meeting today was to ask if you would be, apologies, I've got some through.
it says spam likely. So it's to really sort of check if you as a board are comfortable with a workshop being held in your name, which will specifically focus on healthy ageing. The purpose of that is to help us develop outcomes that are going to be deliverables. So this isn't just about a workshop where we can have a conversation about the issues, but more about what are we going to do as stakeholders collectively to actually sort of work on this agenda. So say the purpose of today is to really sort of check if you as a board are happy with that, and then if you are, then it'll be also looking at the options. There's a couple of options of how that may be delivered. So that's the purpose of the paper.
Okay, thank you. From a RCS perspective, Tracy, do you have any comments at all? Chile mentioned your name in vain, so all your
I'm sure if
organisations
we're offering facilitation that we would support that. And again, I think it's looking at how we do things collaboratively going forward. And if it's based on outcomes, I think, rather than just talk, I think that's one of the main things we need to be focused on.
Portfolio part of the world.
And as I'm probably the oldest one here, yes, I mean, I very much support that in principle, as long as there's something that you've said is what more are we going to do. I think both, certainly the NHS and the County Council, one of the underlying themes is helping people to understand what they can do for themselves, that self-reliance. I do quote quite regularly, we are an ageing population. The numbers of us around are increasing rapidly. We've got to do things differently because we can't carry on as we are. Regardless of financial resource, there aren't the people around to look after this very rapidly growing sector of community. I also, one thing I will mention, I've been round to 1 or 2 care homes as COVID restrictions have lifted, and I call it the Vera Lynn syndrome. You get to a certain age where people think that all you want to listen to is White Cliffs of Dover and Vera Lynn. Well, that was my mother's era. I'm in my 70s, and you can play, you know, ELO, the Stones, Beatles, at the very least, probably some more radical music as well. We need to move on and understand that old people have moved on. We are a different generation. And I think we need to engender a bit more self-reliance and self-resilience. So I'm all for healthy ageing, but I think we've got to encourage people to plan for the inevitable. We are all going to get old, and the sooner we have a conversation with our friends, relatives, the better. So I think it's not so much about what more can we do, because I think we've got to be honest with the public and say there is a limit to what we can do, but what we can do is help you to help yourself. And some of that is planning for the future. Richard knows I'm very keen on, you know, lifting some of the myths about enduring power of attorney. You do not have to use a solicitor. You can do it yourself. You can do it, get all the forms signed, get them lodged, and then forget about it. And they're there in place if ever you get to a point you can't cope. And I think one of the things that adult social services, the NHS pick up, probably the fire service, is when older people end up going into a crisis because they've not planned. They don't think it's going to happen. Well, it does. So as long as that is picked up, and it's not just what we can do as the public sector, but what you can do to help yourself.
I'll take you.
Yes, I mean, I agree with that. And there is something about the cultural shift and the mindset change, because some of the documents I see when they start talking about life changes or older people, they're still referring to 55, 60. And that kind of shocks me, because I think, gosh, you know, they've not kept up with even the fact that the state pension age has moved on to about 66, 67. So I think there is that mindset. as to whether we have kept up to date with what and when old age constitutes, even though my saying always is age is just a number, but it's somehow some change to do with that mindset of people helping themselves, planning for their own, and how can we assist them and facilitate them, and what communication. But this kind of change in the mindset of when old age begins, and we really need to move on from 55, 60, you know.
Thank you, Chair. Very much support having the workshop and agree with much of what has been said so far. I'd like to see people invited to the workshop from district councils who can make a contribution in many ways in terms of the services that we provide, but also in terms of thinking of the built environment so that we don't put barriers in the way of people having active lifestyles, but are able to encourage that as well. I think being older is not a passive state, and there's a great danger of thinking about people as recipients of services and people who need help. And of course, there is an element of that, it is true, but also older people can be a huge resource for society and can help not only themselves, but others. And I think it would be very good to look for examples in the workshop of active older people who make a tremendous contribution to their communities in many ways, be that cultural, in supporting others, or in decision making. So it would be very good to have those examples and to invite people from within the county who are good examples of that way of living. Thank you.
If you want to make some comments on that?
Thank you all for those comments, and I'll probably rush this because I suppose for me part of this work is building on our supportive communities agenda, which is something that is, as those of you know from a county perspective, is very much our preventative agenda in relation to sort of actually all our vulnerable adults. So it is about building on that, and you're absolutely right. To be able to do this, it is about making sure it's about being strength-based, recognising people's strengths, building on those. So I would assure you, Julia, we will certainly be taking that approach as part of this work. I think you're right in terms of the age, and actually, Gary, if you think of some of the conversations that we had when we were talking about some of that research, we were actually trying to shift it. So it was more about a general sort of approach to sort of healthy living rather than an age, because actually in terms of preparing for older age, you actually need to be preparing much earlier. So I think you're absolutely right about age. It sometimes isn't very helpful. So there is definitely something there about that prevention agenda. And yes, in terms of involving the stakeholders, I don't think the stakeholders that we need to be talking to are necessarily just the people in this room. I would like to extend the invitation out much wider. So certainly sort of take some advice of the types of you know, who else we should be sort of inviting, certainly from sort of the district and boroughs and other wider partnerships as well, certainly from Gary in terms of some of the voluntary sector organisations. So very much sort of agree with making this as inclusive as we can, because you're absolutely right. The built environment is so important, isn't it, to ensuring people can live sort of those active lives as well.
I think it's a really interesting insight, isn't it, around almost that self-identity. And I recalling a conversation with my stepmom over the bank holiday around retiring just before COVID, kind of coming out now of COVID and having more confidence and wanting to get back involved in something. And the look on her face when I was going through Staffordshire Connects and saying, well, we'll tick older people as the category and see what comes up. You know, clearly that was not the category that she was expecting me to suggest. She's 70, so she's well within the age bracket that we would be talking about here. I think that I was thinking just now of the analogy of you don't wait until people are 21, 22 before you start talking to them about a job and a career, even though that's probably when they'll be starting a career. We actually start to talk to young people about jobs and careers from, I don't know, age 12 probably. it's something more like that, I think, that we're trying to get at, is, as Councillor Jessel has said, everybody, hopefully, fingers crossed, is going to get older. So we should in our probably 40s, 50s, be beginning to be thinking about what are we going to do when we might be working a bit less than full time, or when we might have finished this career that we've been doing for the last 20 or 30 years. And focusing these workshops in a really positive way around that, I think, would be really welcome.
This goes back to what I said earlier, and Tilly, you'll bear me out on this. The information we've got at South Staffs and the localities, with all the data, the information we've got about and we've got one of the largest ageing populations in the country, because we're all really healthy, obviously, in South Staffs. But the amount of information we've got there that would be invaluable when you're doing this sort of work. And I can give you an instance. Phil Davis, who's a fellow councillor with me at Purton, we set up in 2018 Purton Carpet Bowls Club to combat social isolation and just some gentle exercise. And we had to turn people away because it's so popular. And when it was locked down, we thought people would be reluctant to come back, but they were almost hammering on the doors to get back. And some of them have had hip and knee replacements, and it's actually encouraged them to overcome that and get on with life because they want to get back to bowling. And that's just one instance. It's not sort of really, energetic, but the energy and the exercise is there, and the social side. And for some people, they just come for the cup of tea and the cake and the chat and the benefits they've had. It's well worth it. That's just one example, but I think it could be worth looking at what's going on, not just in the district, but in the different parishes as well, to see what's offered there.
So I suppose, Tilly, it's not just about health and social care. It just shows that it's a communities, place-based agenda as well. So I think it's important that that workshop includes people from as wide, from as wide a catchment as is possible. And and other people have given examples, so I won't miss out the opportunity to give one as well. Certainly. A local library, with the community-based library, with the volunteers. Age range now is a little bit more varied, but originally it relied very much from a group of people who were past that retirement age, who were able to give really valuable life experiences, as well as an opportunity to give themselves some alternative activity and meet new people and new friends and form different things. So so there's lots of things out there, but I think Julia's really right in about it, how that's encouraged for people to do things and help themselves to do things. So it's not just everything is run by state organisations. So I think that's probably one of the bigger challenges, isn't it, so to speak?
No, thank you, and I think you're definitely right, and thank you for those examples, because we certainly know in the experience from the Supportive Communities agenda what is out there in our local communities, by far sort of outweighs anything that can be provided through other organisations. So that's so both voluntary sector, community groups, and that's. I think I was reminded at a workshop that John attended as well, for somebody who was a diabetic and saw his consultant. He said he saw his clinicians probably about 4 times in a year, but most of his connections were actually out with other community organisations, and that was just like one condition. So I think it reminded everybody in that room, who were mainly clinicians, actually you're not the most important people in the management of our conditions. Actually, we've got a plethora of support that's out there, and it's how we connect them. So certainly sort of agree with those sentiments. Mark, is it okay to sort of get, if the board is comfortable, it's the next step really about how? Absolutely. Yeah. So I think there are two options really in terms of delivering. I'd say it could be more than one workshop, but we'd start with one in the first instance. We could utilise one of the existing board meetings that you have, or it could be a bespoke workshop, and I'd say it was just looking at sort of how as a board you may want to utilise this approach and what works best for you, given your sort of series of meetings.
I wonder, and you know, thoughts, please. I wonder whether the best approach would be for you to organise a standalone, separate workshop. Not just obviously with members of this board, but you know the attendees, some of which we've probably discussed, and then develop something, and then perhaps bring that back to the board. That would be my personal sort of view. But obviously, if people have got alternative views, please air them. I think we're in agreement with that. Then, Tilly, is there anything else that you want? Because I think you've clearly got broad agreement across the board to carry on with this piece of work. Okay, Tilly, thank you very much for your attendance today. Okay, ladies and gentlemen, that brings us on to item 6, which is the forward plan, which you have a copy in the in the notes. So the next meeting is the 1st of December, I think. Yes, the 1st of December. And so far on the forward plan, we got the Adult Safeguarding Board annual report, the loneliness strategy, and I think the most important part of that agenda going forward was the consideration of our relationship between this board and the local National Health local system, the ICB, and that. And I understand Richard, yourself and Claire putting something together around that, and I wondered whether it'd be useful in developing that to meet myself and Julia, so we can sort of start that work and how that should go forward, so that we've got something concrete for members of this board to sort of have a look at in December.
Yeah, that would be very helpful, Chair, and I'm sure Tracy will need to meet with Peter, yourself and some of the ICB folks as well to understand how that's going to work.
Yeah, more than happy to, because of course we also have the integrated care strategic plan that you'll probably need to receive at some point, but as you've got it on the 1st of December to discuss, I'm sure that will all then come in to see how it all joins together. So yeah, absolutely.
Any other comments on that particular item? Julie?
I just wonder whether we need a representative of the districts and boroughs, because I think in terms of loneliness, they're, you know, quite close to their local population. I don't know, I'm asking a question, but no.
Okay, we can give that some thought. We can give that some thought, can't we? And then the last item on the forward plan for the next meeting is an update on the recent release of the census and the key findings. So my apologies that it's been a shorter, or should I say apologies, I don't know whether that's the right terminology, or that it's been a shorter than usual meeting. So thank you all for your attendance. Before we finish, just a quick opportunity, if there's anything around agenda setting for the future that anybody would like to raise. If there isn't, if you have any thoughts about areas of business that we need to look at that fit in with our strategy, then please let myself and or John know, so we can take them forward. So if there's nothing else, thank you very much for your attendance.